Hey, good evening, everyone. My name is Dr. Andrew, and I'm really looking forward to this webinar because I truly believe that I have important information to share with you all tonight. If you're listening tonight, it's probably because your child is struggling and you're wondering, why is it happening? You're wondering, why are they dealing with so many ear infections? Why is it that their body can't heal like it's supposed to? Why haven't the antibiotics worked? And most importantly, you're wondering what you can do to help, what you can do to help them stop suffering. As a chiropractor who focuses specifically on pediatric care and has a lot of extensive training on caring for kids, I could tell you countless stories of kids in our office who've been dealing with recurring ear infections and who've been down that path, but don't have that anymore, that's a part of their past, not their future. And that is why we're doing this webinar. That's why I'm sharing this information, because I want that for your child and I want that for your family as well. That's enough about me. This isn't a talk for you to learn about myself. I know that's not what you're here for. You want answers, you want help, and that's what I want to share tonight. I want to share information that might change how you think about this topic. It might challenge some of your beliefs and what you know about ear infections, but I want to provide you with some information that might let you think differently at the end of it, and maybe you can decide to do something differently about it as well. So I want to jump straight into everything. Just checking our broadcast, making sure that's working well. So let's start off tonight by talking about an extremely common misconception regarding ear infections, and that is this: that many pediatricians, many healthcare providers will say that it's normal for kids to get ear infections. It's normal that 90% of kids by age 2 are dealing with this because their tubes are simply more horizontal. They're tubes that run from the ears to the back of the throat. They run more horizontally, and they're just not able to drain as well, which means that the fluid sits. And that's not the whole story here. Let me, to explain further about this, let me pull up our slide share, and we're going to look at a picture of the ear. So we're looking at the eustachian tube here that runs going from the inner ear down to the back of the throat, like I said. And yes, it is absolutely true that that is more horizontal in kids. But the thing is, gravity doesn't really play much a role in that fluid draining. It's not like this tube is a hollow pipe, like a drain pipe, that the water just flows whichever way it's tilted. This is like a muscle. Think of it as like more of a tube of toothpaste. What depends on whether or not the fluid flows is the squeezing muscular action of that tube. It's something called peristalsis. And really that's where the best analogy I can give you is if you're squeezing the toothpaste from one end to the other, that is how the fluid flows through this tube. It's the same way that food moves through your GI system as well through digestion. It's this peristaltic motion. It's contraction from one end to the other. So that pushing of the fluid is what drains it, not whether or not they're more horizontal. So what becomes really important is not gravity, but movement. Movement is really the key in this whole thing. And if there's not movement, if there's not motion, if there's not this peristaltic pushing of the fluid, that's when problems breed. Because yes, the fluid does sit there, and anytime fluid sits in your body, it's not a good thing. It's breeding ground for infection, whether that's viral or bacterial infection. Bad things are going to happen. So if we understand that it's not so much a gravity thing, but it's more so that our tube's muscular action is what is pushing the fluid out, what we need to think about then is, why might not that movement be taking place? Why might not the fluid be being pushed down the tube? And to answer that, we need to go back and talk about birth injury, birth trauma. That's what you see on your screen here. One thing that we see time and time and time again is infants, whether that's little ones dealing with colic or reflux or nursing problems or constipation, on up through toddlers or young ones who are dealing with ear infections, is that more often than not, they had a birth process that didn't really go as mom and dad wanted it to. They had a birth process that maybe there's a lot of stress in pregnancy, maybe there's a lot of extra intervention used during that birth process, and the infant, instead of being allowed to come out as mom and baby call the shots, and there's the ebb and flow between their hormones and their systems, the medical team has to intervene and pull or extract the baby from mom. Maybe that's through C-section, maybe it's vacuum extractions, forceps, or maybe it's just the doctors or midwives' hands around the head and the neck, pulling, turning, and twisting. I've got our doll Sophia here. You can imagine with Sophia that if this was a real baby and I grabbed her around the head and the neck, hopefully you all would be irate, right? I personally just had a newborn son. He is not even a week old. I'm home with my wife tonight. And if anyone took baby Zion by the head and the neck, I wouldn't be here right now. I would be in jail. I would be being prosecuted for whatever I did to the person that did that. We all know how important this area of the newborn is, and we all know how fragile they are. We would never think of doing that. But unfortunately, during that birth process, there is a lot of pulling and twisting and rotation that takes place. And when that happens, what we need to understand is that it's going to cause damage to this upper part of the neck. The top couple vertebrae we have surround our brainstem just under the base of our occiput, and those structures, the cervical vertebrae here, are really connected to the flow of the ear and the flow of this eustachian tube. So if we have the birth injury, if we have birth trauma that shifts and misaligns and rotates the top of the neck, what it's going to lead to is tension on the eustachian tube. So the muscles that are attaching to the eustachian tube are also attaching to the structures and the soft tissue around that top of the neck. And if they're stuck, then that's going to be abnormally pulling and shifting on one of those tubes, or maybe both of them if it's severe enough. And that's going to lead to the fluid not being able to pump, fluid not being able to flow down, and then getting stuck and backed up and leading to the ear infection. So basically, we've got poor plumbing, and that's what the easiest way to call it. We could summarize everything that we're talking about right now by a little one that's got poor plumbing. So what we need to do then is figure out what we can do to increase that motion and to restore it back to a proper function. And that is where the adjustment comes in that we'll talk about here in a minute. Unfortunately, that's not the only reason that this is happening. Not only do we have birth injury, shift and misalignment and stress at the top part of the neck that is preventing that fluid from draining, this area of the brain, the nervous system, is also incredibly important for our immune system. The vagus nerve, different areas of the brainstem are involved in the processing and the control of our immune system. So when there is stress up top here, our immune system is not able to function as strongly as it's supposed to. Now we've got extra fluid sitting, we've got extra bacterial or viral infections breeding, plus a decreased ability to fight them off, a weakened immune system, which is really a rough combo. Like I said, when we get to our role as chiropractors, what we're doing there is correcting that underlying movement abnormality, or correcting that shift and that stress in the neck, that imbalance. When those joints are misaligned and fixated, when they're stuck, instead of moving properly, the fluid is not able to move. So an adjustment in a newborn, if you're familiar with chiropractic care, you might be wondering, what in the heck is that like? You know, when I'm getting adjusted myself, there's a lot of force, or there's, vigorous movements, anything like that. That is not at all what adjusting a baby is like. That's not what adjusting a newborn is like. If anyone is doing that, a chiropractor, I'd encourage that you seek someone with additional pediatric training. What we're doing with a newborn is very gentle, very specific. It's a light, sustained contact. It's, the pressure that I'm using might be the pressure that you would use to check the ripeness of a tomato or an avocado or something along those lines. It's very gentle, very specific adjustments. So we've got this double combination of really kids being set up for failure by having poor plumbing, by having that misalignment and fixation and stuckness in the top part of the neck, as well as that affecting the immune system because of the brain, the brainstem and the vagus nerve that's up top here. So one of the other misconceptions that we need to address is, okay, yes, maybe this is all true, but so what? They're going to grow out of it. It's going to be fine. They're going to move on. And that, unfortunately, is also not what we see. So it's not so much that they grow out of this problem. Honestly, what we see is that they grow into other problems. We see the newborn who is struggling with some of those newborn challenges I mentioned earlier, colic or reflux, nursing issues, constipation. Often is the newborn who turns into a little one that's dealing with ear infections. And that little one grows up to be someone who's got recurring strep throat infections, maybe tonsils and adenoids end up coming out, respiratory challenges then sit in, allergies, asthma. And often that leads to more neurologic issues, sensory processing disorder, OCD, ADHD, anything along those lines. That is what we call our Perfect Storm workshop. That is a much more in-depth, deeper conversation. That's something that we actually have a workshop coming up next Wednesday evening, February the 6th. So if that's something that you feel like applies to your family or your situation, please join us there. And we'll share more about all the details involving that perfect storm and how we can help. But the point is that they don't grow out of it. when that underlying cause of the problem still exists, when that underlying issue is still present, it's not going anywhere. It's going to lead to further and further damage and further what we call gas pedal stress. Their body is stuck in a fight or flight, scared gas pedal mode. So what I think the best thing that I could do to share with you a little bit more about what we can do in regards to ear infections is using the story of my good friend Eli. So let me show you, introduce you to Eli here. So this little man always will be one of our favorite stories because he was one of the first patients that we had the honor of caring for at Thrive. We met him when he was around 1.5 years old, and he had been having an ear infection a month for about the last 6 or 8 months. He was at the end of his rope. Pediatrician told his mom that the next option is tubes. There's really nothing else that we can do to help. He's got to get something changed. Fortunately, she didn't want to go that route. She wanted to get to the root of this problem. She wanted to help him truly thrive and not continue down that perfect storm pathway. So she reached out to us. We connected and we got this little man under care. And when we first met him, we learned all that about his history. We learned everything that was going on with those ear infections, but also we did an important set of scans, important set of neurologic tests that are telling me not just how his body is feeling and the symptoms that he's experiencing, but what's actually going on underneath the surface. Is there imbalance in his nervous system? Is there an inability of his body to heal? Is there a disconnect between his brain and the rest of his body? And as you can see on the scans here, if your intuition tells you anything, is that was absolutely the case. We saw that the top part of his neck, there's that blue and the red bars there. Those are moderate and severe imbalances or shifts in the spine. We saw that he had a lot of stress, a lot of imbalance up top. And that is what leading to these recurring chronic ear infections. Thankfully, that was then, and now is a lot different. So this is over a 1.5 years later now, and he has not had an ear infection since we met him. That was June of 2017. Not only that, at the end of his couple months of care, as you can see his mom's wellness goals progress exam check sheet, not only was there massive change in ear infections, but he was sleeping better. He wasn't getting sick as often. He started to talk more. So many other changes just skyrocketed throughout that couple months of care, because his body was able to heal better, it was able to function better, and it was able to do what it was designed to do. Because our default mode is healing and growth and development. And when that's not taking place, it's just because the body has something blocking that from going on. So we could go on and on about more of the perfect storm pathway, more of what is really at stake here. But honestly, I know you just want to get help. You just want your baby, your child to not be in pain, not to be in discomfort all the time. So as we're, let me get off of our slide share here. There we go. As we're wrapping up here this evening, I can tell that you guys are just wondering. If you're listening in here, you're wondering what is going on. You're wondering, is this really why my son has had to take antibiotics so many times? Is this why my daughter is always sick? Is this why they've had round after round of ear infections? And is this why they can't heal? Because the shift in the spine, because this tension in their neck and their nervous system that's preventing their body to function as it's supposed to. You want to know, could it really be that simple? I can't answer that here tonight, but what I can give you is an opportunity to find out. The way we would do that is through this exam process, through our scans, through our evaluation in the office. We always start off that process with what we call a complimentary consultation. That's a chance for you to make sure that we're the right fit for what you're looking for. You can ask any question. We'll give you an idea of what to expect for care plan duration and frequency and costs involved and anything that you would want to know. And as long as we are the right fit, as long as we're what your family is looking for, we'll then proceed on to the complete examination. That's where we'll dig into the history. We want to talk about that perfect storm pathway. What was the birth process like? What was early newborn challenges? Because I wouldn't be surprised if you're listening this with us here and your child has been dealing with ear infections. Think back to how they were as a baby. And more often than not, that was a child who was more fussy, more colicky, like I said, struggling with nursing or latching or constipation from the get-go. So we'll dig into all that. We'll do the scans. We'll do our evaluation like we talked about. And at that point, we'll come back a few days later. I need some time to dig into that information and evaluate what's going on. When we come back, I'm going to tell you what we found. I'm going to tell you if we can help. I'm going to tell you how long it's going to take, what it's going to cost. And then that's up to you what you do with that information. You can say, okay, let's do it. I want to start. I want to make a difference. Or you can walk away knowing that that's an option. The way that whole process costs $150, but what we can offer you, if you mentioned that you were joining us here this evening on our webinar, is $50 gift certificate off of that. That would bring the cost down to $100. So please reach out. We want Eli's story and the story of so many others in our practice to be yours as well. We don't want to see more kids suffering with ear infections, dealing with the ongoing immune systems and neurologic challenges that come from that. So give us a call, send us a message, please let us know what we can do to help. We're here to answer any questions and do whatever we can. All right, guys, thank you for your attention. Thank you for tuning in, and I hope everyone has a great evening.